All right, well, as it often happens in Washington, Senator Cassidy can attest to this, that staff, I asked him if he had any time in his schedule. He says, John, you know that my staff tell me what to do. So in order to keep him on his schedule, we're going to go ahead and start. Some quick background, Senator. You have 240 folks from all 50 states here. They've been talking all day about suicide prevention and mental health. They're going to visit all 98 of the other Senate offices, not including you. Well, they'll visit with you and Chris, but and the number one ask is going to be to support your mental health reform legislation. So by show of hands, let's give the senator a sense. How many of you are survivors of suicide loss? You lost a family member to suicide, okay? How many of you have survived your own suicide attempt, lived experience, okay? And how many of you are mental health professionals who are involved for a variety of reasons? Okay, so that gives you sort of a sense of what's going on. So I think I'm going to start, and I've had the honor and pleasure, you've seen Trevor out in the hallway. We've been meeting with you and Chris in small meetings. You had an incredible mental health summit a couple weeks ago. Yeah. We had a room, I think, this similar size that was full of people like the folks that are here today. Why do you think the behavioral health system is so broken, and how do we start to fix it?
Well, my staff gave me notes for all these sorts of questions, but let me just pull a Trump on you and throw them away. I think there's a couple reasons. We know back in the early 60s, people were warehoused with mental illness. And it was a terrible state of affairs. One Flew Over the Cuckoo's Nest shows you the power of an effectively done film to change a culture. And it made the sense of warehousing with, made Nurse Ratched a term of endearment. No, it made it a cultural term. And so I think, one, it was a reaction. And we have President Kennedy saying that we could do something different. And it seemed so much better to do it the way he proposed, and yet there was no follow-through. Now, if you combine that with the stigma of where I'm old enough to remember just when I was a child that people would not speak about having a diagnosis of cancer. There was some sort of moral shame associated with cancer. If you combine the fact that we thought we could do it better, but there was no follow-through, with a still lingering stigma, almost sense of moral shame associated with mental illness, then you have the situation we are today, in which it is a problem ignored, solutions that might work are feared, and the stigma has led it to not being openly discussed.
Okay, good. I agree. There's been lots of questions on both sides of Capitol Hill about privacy and the HIPAA rules. Can you unravel in layman terms what has to be done to educate folks and to tweak the current system?
So I'm assuming everybody here has had their frustrations with HIPAA. Yeah. The girl, anecdotally, but it just shows everything. The woman I went to high school with, and she is the caregiver for her adult son. And if he has a psychotic episode, it is she who brings him to the ER. And they won't tell her when his follow-up visit is, or what medicines to take. She is a healthcare professional. It's not as if she doesn't have the sophistication to understand all this. But if he had diabetes or hypertension out of control, they would. So going back to how we kind of segregate out our mental health from our physical health to the detriment of the patient, it's just intolerable. So we had this hearing when I was in Congress on the House side between experts on HIPAA. And the experts got in an argument with each other about how to interpret HIPAA. Now, these are folks who write academic articles. They probably read each other's articles. And they were in an argument. And I said, if you're the ER physician, it's 3 in the morning, you've got 10 patients lined up, and you're not sure how to handle this one, I can tell you what that ER doc is going to do. She is going to default to that which is easiest, which is I cannot give you information. Now, I don't need to tell you that there's a lot of sensitivity around HIPAA. Again, and that's rightfully so. A lot of sensitivity. So the path we've, and the House bill went at it more aggressively, but they kind of ran upon the shoals of privacy, those concerned about privacy, civil libertarians, et cetera. We kind of tried to take that middle path. That middle path, if we can get those experts at the panel to agree, and then to make sure that it is promulgated among all the attorneys at all the hospitals, so that in turn, when that ER physician calls up their hospital attorney, the hospital attorney knows exactly what to tell her. We're trying to go that route first. Right? Would it be great if we could be more aggressive? Absolutely. But we just have to recognize in a pluralistic society, it's going to be a little difficult.
I think that you and Senator Murphy used the term the best interest standard.
Yeah.
Could you explain that to the group?
So if, let's go back to my high school friend. Look, we have the same address on our driver's licenses. Look, I am the one who the mental health professional will tell you has been bringing him to his appointments. I'm his mother, by God. It is in the best interest for me to know when his follow-up appointment is. It is in the best interest of me to know how he should take his medications. It is in the best interest of me to know that concern that you have documented in your chart, but you're a little nervous to tell me. It is in the best interest of the patient for me to know that. That is a common sense, a little bit like pornography. Hard to define, but you know it when you see it. At some point, we have to trust the common sense of the provider and the patient's caregiver.
Okay. And again, I've been in enough meetings with you now in your office or at various town hall meetings. You've talked about the need to rebalance the spending. I wanted to share with you, this is actually the sheet that our advocates are going to share tomorrow on Capitol Hill. And we showed the investment in some other diseases, and you can see this is over a 10-year period, each year for 10 years, the resulting connection. So do you think if enough of us can convince your colleagues that there needs to be a rebalance, that if 40 million Americans are living with depression, and then you add another 10 or 20 million that have an alcohol or substance use disorder, you're looking at something south of 75 million Americans that have some type of mental health issue, and we're not spending the kind of money in the research area. One of the panels we had this afternoon was, how does investment pay off? And again, I've heard you talk about, it used to be, you and I are old enough to know that HIV/AIDS used to be a death sentence 25 years ago. But because they got a codification in law that gives them in perpetuity 10% of the total NIH budget, they get an incredible amount of money. And this is not for us to play a disease against another disease, but how do we handle that on the Hill? I mean, how do we...
So I think you got at the point, but let me just kind of put it out very, very plainly. If you look at the federal dollars spent on research, there is an imbalance, not noted by just a random person walking down the street. I can never remember whether it was Government Accounting Organization or the Institute of Medicine, but one of the two. My staff always laughs because I can't remember. Say it's Institute of Medicine, but under the Clinton administration, they looked at this and said, really, we are spending a disproportionate amount of money on HIV/AIDS relative to other pressing healthcare needs. Now, I was in Los Angeles when the HIV/AIDS epidemic broke, and that was incredibly tragic. And our country did the right thing by pouring the resources in required to address that. But we've done so. So that now, someone with HIV/AIDS, if she or he takes his medicines, is more likely to die from suicide or Alzheimer's than from Kaposi sarcoma. Now, so what the IOM report says, we should just rebalance that. From my perspective, it shouldn't always be mental health. I would like to think there will come a time when mental health has been addressed so well that we would then move our concern to something else. So, and one of the arguments against it has been that there was not a sufficiently mature enough body of research to invest the dollars in mental health. And Tom Enzel, who was just recently left the National Institute of Mental Health, said that's not true. And Dr. Volkow, who's at the head of the National Institute of Drug Abuse, says that's not true. So if you speak to the leaders of those institutes, they absolutely think they have a maturity in their understanding that more research dollars will help. So from my perspective, it's been a little, John, I'm a little rusty on this statistic, but I think I know we spend something like, this number I'm making up, but conceptually I'm there, about $400,000 in research dollars for every person who dies from HIV/AIDS, and $987 from every person who dies from suicide.
Probably makes about sense, yep.
So again, in the hundreds of thousands for one, and less than 1,000 for the other. In years of life lost, I can go through all these other statistics. It would demonstrate a crying need that we do rebalance, that we shift this to wherever Americans are having the most problems. And hopefully, again, we'll have the privilege of rebalancing once more.
Okay, so again, our people should go in tomorrow and advance the notion that research is critically important and that the Congress ought to find a way to increase funding for suicide prevention and mental health. And I think you and Chris have made a commitment that in the next Congress you'll work on some funding ideas. Talk a little bit about your current bill. We spent some time this morning.
Can I just say one more thing about that?
Sure.
There has been a significant, we just increased the budget for NIH by $2 billion.
Correct.
And this year we propose to increase it by another $2 billion. Correct. On a baseline of $30 billion. So up roughly 15% or something like that, over 10%, 10, 12%. So we are making progress.
We have to get the House side, though, to go along with it.
They went along with the $2 billion before, and I think that there's a tremendous interest. I can't speak for Democrats, but I'll speak for Republicans. We understand that the only way we get out of these high-expense illnesses like Alzheimer's, dementia, mental health, which somebody says a quarter of all medical spending in some way might be related to someone who either is mentally ill or has co-diagnosed with mental illness. Well, that'll break the bank. Right. Unless through medical research we find a way to bring healing, and just as once measles and polio could have broken the bank, but with vaccines, now it's something you don't even think about. So we can, if you will, take care of that future expenditure, that future exposure, by doing the research now for illnesses such as that. So just a bit more about spending. I'm sorry.
No, that's okay. So, I mean, we're trying to give tips to our people. So I want to go back to your bill. If I understand it correctly, you and Senator Murphy, your current legislation will be focusing on the 4 to 5% who are severely mentally ill. So would it be fair to say you've opened the Pandoras box, and we got to deal with that, and then hopefully in the next Congress, as we start educating your colleagues in both the House and the Senate, we can then start looking at the broader picture, which might include more research funding, you've talked, Dr. Cassidy, Senator Cassidy is a physician, so he understands the whole patient and what's going on. We gave him an award. I don't know if he remembers, when he was on the House side, he was the Republican lead co-sponsor for the Garrett Lee Smith. Oh, yeah. And he was so humble, he came to the Reserve Officers Association and told all of our advocates that he wanted to come back one day and give the award back to us, because this is how he operates as a public servant. So he's included the reauthorization of Garrett Lee Smith in his current bill, and I think it's going to take a community, okay? We talked earlier, you may know Barbara Van Dalen from Give an Hour and the Change Direction campaign, that the government can't do it alone. So it's organizations like AFSP and Give an Hour and IAV that are working together. So what do you think the proper role is for the federal government? And then what's the role for groups like ours and other organizations out there that might have boots on the ground that could help tie the dots together so there's not a reinvention of the service wheel at the local level, but in fact we all work together?
So this is the third conversation I've had like this, and just most recently in the foyer with my folks from Louisiana. If something typically does not reach the floor of the Senate or the House of Representatives unless it kind of organically bubbles up from the body politic, from you, from us. And hey, Chris. And Chris today will announce he's becoming a Republican.
Yeah.
Just let you know.
That serves me right for being late.
No problem. There's some water for you, Chris.
So, on the other hand, there has to be ears to hear it in the Senate and the House. Now, that's a symbiotic relationship in a democracy, right? In which, listen, we know this is a pressing need. It has to be addressed. Oh, I can hear your cry. And it kind of goes back and forth. And as we go back and forth, it begins to recruit others to our cause. Now, it is a cause. I'll say it is a cause. So the way I see it, John, is that you, us, have all had personal tragic experience in some way or other with suicide. And we begin to recruit others, hey, let the stigma go. Understand that something different has to be done. There must be legislation. So two guys come together who are somewhat different politically, but nonetheless are united here, and we begin to recruit others. It's more easy to recruit because you are also recruiting for us. And again, you have that symbiotic relationship, and it just begins to grow, and at some point it passes. We hope it's this Congress. We think it's this Congress, but if not, it'll be the next. And it will only occur because, again, this interplay between those represented and those representing to recruit others to our cause for critical mass to achieve passage.
Okay. Well, now that Chris is here, I want to back up a little bit, okay? I don't think I told either of you I started my career 40 years ago. I was an intern for Evan Bai's dad, Birch Bai from Indiana. So that tells you how old I am. So I can remember 1977, and I told that story this morning, that I can remember advising our bosses on issues. You'd go to the floor, you'd vote. At night, we'd go out and play softball together. We'd drink beer together. Some of us slept together, and then we'd come back the next day, and we'd move on to the next issue. So I think you guys represent, there's so much bad press coming out of Washington. How did a progressive Democrat from Connecticut and a conservative physician from Louisiana get together? And have you had problems selling your legislation in your respective caucuses?
Well, listen, that's a great question, and those were different days. Not all of those ways in which you interacted are recommendations for how we should do bipartisan agreement going forward.
I meant staff slept together.
I understand your point. No, this is listen.
As far as I know,
and you know this as well. I mean, listen. There's an element here to which the way in which politics is covered is a little bit divorced from the reality of how this place functions, right? So politics is covered as soap opera, as sports. So only the disagreements, only the dysfunction, only the loudest, most inflammatory voices get onto the cable news. And when we actually agree, when we actually pass pieces of legislation, it gets covered for a nanosecond because that actually doesn't sell ads. So, Bill and I worked very hard on the committee that we sit on to rewrite the nation's education laws. We repealed No Child Left Behind. We handed power back to the states and to local school districts, and virtually no one knows we did that because it was a moment where we, where we got together and we did something constructive without a lot of partisan rancor. And so that's one element of this story. But I think the reason why we've been able to be successful, and we have, I mean, Bill probably mentioned it, but we have not only our names at the top of the bill, but we have 8 Republicans and 8 Democrats representing a diversity of our caucus. We had a unanimous vote in the Health Committee. That means that Rand Paul and Bernie Sanders were both voting in favor of this piece of legislation. I think that's because, as Bill was suggesting, this comes from shared experiences. Regardless of what your ideology is, you have a family member or a neighbor that has been touched in a very deep way by mental illness and has probably had some pretty miserable interactions with the system. Sure. And so I think that that's the commonality here. And we've tried to take the politics out of this and try to make this rooted in a much more human experience. And so Washington is not as dysfunctional as it appears, but it's still dysfunctional. And we've tried to address that by keeping this as apolitical as we can.
Okay. I don't mean to put you on the spot, but we've asked Senator Cassidy several questions. I've been in enough meetings with you to hear you talk about this. So you've talked about the fact that you believe, and I think Senator Cassidy believes the same thing, that the science around mental health and suicide prevention is way behind the other disease groups. Can you share your thoughts about that? Because we had a whole hour panel this afternoon about why funding needs to be increased for research and why it's so important.
So, I'm not going to be able to add anything that your panel didn't cover. I just think the stigma that is associated with people with mental illness and families that are dealing with it has long been attached to the people who want to research it. And this is what I mean by it, that there's been this sense that there is some mystery around mental illness that is fundamentally different than other diseases that afflict your body. And so, researchers have kind of been told earlier in their careers to stay away from it because there's not as much science involved in studying mental illness as there is in studying heart disease or studying cancer. And of course, that's ridiculous. Yes, mental illness is different in that it is an illness of the brain often wrapped inside of trauma, right? And that is somewhat different than how you fix a broken leg, but there's no less science involved in how you treat that trauma. There's no less data involved in the efficacy of this treatment or that treatment, this prescription regimen versus that prescription regimen. And so I think that stigma that still exists for people living with mental illness has been attached also to researchers. And so that's why we both believe that we've got to congressionally direct more money into this field because the market of research hasn't necessarily advantaged this research. And by the way, there's nobody, there's nobody more articulate on this subject we also sit on the Appropriations Committee than Bill Cassidy.
Do you want to chat for a second, Senator Cassidy, about what you've told many groups before about the heavy work that Chris has done on the Democratic side in terms of keeping people on his caucus involved and what he had to do to separate, especially in view of what just happened in Orlando, that the minute there's a mass shooting again, it gets jumbled, and how do we work to separate the fact that guns and suicide are related, but that we have to have a conversation about the mental health side of the equation and not get lost on the other side?
So I don't forget, I'm going to interject something quickly.
Okay.
You mentioned staff in a certain context. I'll just mention that one of the reasons that we've worked so well together is our staff has worked well together.
They do.
So Brenda, is Joe in the room?
Joe's still here. Yeah,
Joe, I don't know where Joe is. My eyes are bad. Oh, there's Joe back there.
Joe
and
back
Brenda,
there.
will you stand up,
Down.
Brenda?
Yeah.
Chris has been fantastic. We've avoided some of the fights that have occurred on the House side because Chris has been incredibly sensitive to issues that as the House has had problems with. Just to say that over and over again, whenever I see, oh man, they're having a problem with that, Chris is the one that kind of guided us away from that. And I would have said, no, Chris, we need to go there. And so that was just a real delicate touch. And we would both agree that this is not the end-all bill. This is the next bill that will lead to the next and the next. And I think that was Chris's understanding that was more mature than mine at the outset. Secondly, as regards the gun issue, particularly with another mass shooting. But to be frank, if this bill becomes entwined with the gun debate, the bill will not pass. So, whatever your feelings about it, whether you're pro-Second Amendment or you're pro-gun control, that is just a political reality. And we need to differentiate that. And again, Chris puts it very well. I won't speak for him, but just to say that that is something that we're both negotiating on our respective conferences. Because one conference tends to be pro-Second Amendment, the other more pro-gun control. And so that's where we are on that. And Chris, I'll let you speak to that as well.
I think it's important that Bill and I are in very different places when it comes to our views of gun policy in this country. And I think that makes our partnership more powerful on the issue of mental health because we don't have the same views on the issue of gun policy. And of course, Bill is right on the practical politics associated with this. We are not going to get this bill passed if we have to debate mental illness and gun policy at the same time. And this is me speaking here, but I have been very careful about how to talk about this, because there's no doubt that there is an intersection between guns and mental illness. But you cannot explain away America's epidemic rate of gun violence, it's just me talking here, this is not both of us, through mental illness, in that this country has a rate of mental illness that's comparable to other countries, and yet we have a gun violence rate that's 20 times that of other countries. And so there's something else going on here that can't be explained simply through the prism of mental health, even though there is clearly a very direct connection here. So, we're trying to tread carefully on this issue. We think that we should come together where we can find common ground, and we think we've found that. And then we should live to fight another day on these issues around background checks or assault weapons policy. There's plenty of time to debate that issue moving forward as soon as we can on mental illness
Well, let me
policy.
tell you, our organization, obviously, we're the American Foundation for Suicide Prevention. We've determined as an organization that we are going to get into gun safety education, and we're actually collaborating, Chris, with an organization in your state, the National Shooting Sports Foundation.
Yep.
And we're going to do 4 pilot projects, one in Alabama, one in Kentucky, one in Missouri, and one in New Mexico, is to get together with each of the groups, the gun owners and the gun sellers in those states, and come up with educational materials to say, if you're a gun-owning family and your son John is diagnosed with depression, what's your family's plan to deal with it?
Yeah.
So we'll let you guys know about that.
Important.
2 more questions, and then we'll take some questions from the audience. And I think you've been asked this before, if one or both of you are invited into the Oval Office on January 22nd, the day after the next president is inaugurated, what would you tell him or her about what they have to do to move the ball down the playing field?
Well, yeah. My messages might be different depending on who's there. Well, I guess it wouldn't be that complicated for me. I feel like we have constructed a platform. And listen, our hope is that we are going to be talking about the next iteration of mental health reform, that our piece of legislation will be passed and into law by the time the next president is there. But if that has not happened, then I think we'll both be asking the next administration to take up this cause. I'll just tell you my personal belief is that the administration can do a lot to promote the integration of physical health, primary care, and mental health care. And the administration has already set these very ambitious goals to change the way that we pay for health care away from a volume-based reimbursement system to an outcomes-based reimbursement system. And that is in many ways the salvation of the behavioral health system, because if you have to treat the whole person, then you are going to pay a lot more attention to those early warning signs. And you're going to put a lot more money up front when you're starting to see something that resembles the beginning of a psychotic break, something that represents the beginning of bipolar. And so I would just tell the next administration to stay with it, keep going on this drive to switch reimbursements to an outcomes-based system, and in as many ways as you can, force the integration of those 2 systems together.
Senator Cassidy?
I would start off with whomever I was speaking to say, we got a huge problem. Huge, really big.
Whoever you're talking to, yeah.
But that we can make mental health great again.
I've got to go. See you later.
And the way I would do it is exactly what Chris said. If we're spending 25% of our healthcare budget on people with either mental illness or co-diagnosed, go where the money is. If you want to have the biggest bang for your buck, then, and now I'm speaking like an economist, but you speak with an economist by saying, if we take care of this 25%, we're going to lower costs in so many other areas. And the research that comes here will spill over into research that benefits those who have drug abuse issues, those who have lower productivity because of depression. I can go down the list. You can give a better list than I. And then I would finish in saying, but it's not about economics. It is about broken lives. It's about broken families. If you take care of this, Madam President or Mr. President, I can guarantee your re-election, because there is no more kitchen table issue than this.
Thank you. Thank you. All right. Last question for both of you. Chris, you told Senator Cassidy when you first came in, we're taking out a half-page ad in The Hill tomorrow, and everyone in this room will be visiting your 98 colleagues tomorrow.
Great.
So you've got 8 on both sides, so we'll tell them who those 16 people are. Yep. What should they tell? What's the one message we will share either with people like Joe or Brenda, or perhaps with the member themselves? What should we tell them? Why should they urge Mitch McConnell and Harry Reid? I told them all that you had that incredible mental health conference 2 weeks ago where I spoke at the press conference, and we hand-delivered those 240,000 signatures, both as a part of a PR, but to physically show them. So how do we help move the dime? You know that we now understand they're going to start the markup on the House side tomorrow and complete it on Wednesday. So we think we can get some things going there. So what advice do you have for our folks?
Well, listen, this is a very political time, right? I mean, we joke about the presidential election, but it's real. I mean, the umbrella of what is going to be a pretty nasty presidential election makes accomplishment in the Congress difficult. And I think part of the message is that as you look at the big, meaningful pieces of legislation that could be accomplished in a relatively non-political, nonpartisan way, this is at the top of the list, right? You're not going to get many more pieces of legislation that can change lives that have 8 Republicans from the moderate to the conservative wing of the party, 8 Democrats from the progressive to the centrist wing of the party, that if you want to do something meaningful in the middle of a presidential year, that this is your opportunity. And I think the message is also that people are sort of sick of window dressing. I mean, we wrote a bill that's a comprehensive reform of the mental health system because we know that people are sick of being told that there's change coming and it actually never comes. And so I think that you want to engage people to tell them that this is rare. It's rare to get a comprehensive reform package that has this much bipartisan support. And if you want to get anything done that's meaningful in a sort of political time, this is really one of your only opportunities.
Doctor?
Yeah, I always want to know what's in the bill. Chris will make the point, there's so much in the bill, you sometimes don't know where to start.
Right.
So as a physician, I always look for little mnemonics. It got me through medical school. But the one I use for this is which is access, accountability, and HIPAA. So I go and I say, listen, mental health issues are pervasive. Suicide is pervasive. Addiction is pervasive. In your family, you have been touched as I have been touched. Under our bill, A is for accountability. We give accountability for the federal government to spend hard-earned taxpayer dollars more wisely. The second A is for accessibility. We increase both the supply of mental health professionals, the patient's access to those mental health professionals, and the mental health professional access to better science in order to better treat. And lastly, HIPAA, or H, for privacy, if you will. Sounds better than op. But you can speak to HIPAA as well as I, or better than I. Excellent. So if I can tell them what's in it, and then how these 3 provisions, accountability, access, and privacy, will help the pervasive problem we have now, we'd like to think that would be a compelling argument.
And let me add, when you talk about access, one of the most meaningful parts of this bill is relative to the issue of insurance coverage for mental health. Everybody here can tell a story about a nightmarish experience, either personally or somebody that you know, trying to get reimbursement from your insurance company for mental health treatment. Now, we have this law in the books that says that you are supposed to have an equal benefit for behavioral health as you do for physical health, but we know that in practice that doesn't work, that there's lots of bureaucratic hurdles that get put up to behavioral health access that don't get put up when you're trying to get reimbursement for a broken leg. Our bill, in a bipartisan way, has the next generation of insurance parity in which we will start to force insurance companies to take down those bureaucratic hurdles to care so that the administration of the benefit is equal, just like the statement of benefits that you receive in the mail is equal. So when it comes to access, that's a really important other piece of the pie.
Okay. Are there any questions? I also neglected to tell both Senator, I think I told the staff, we are live streaming, so thousands of...
You tell me now.
Well, no, it's thousands of AFSP volunteers across the country are watching what's going on. So we plan to augment the visits tomorrow face-to-face with phone calls and emails to the offices. So are there any questions? We have a few minutes for questions. Senator Murphy, the folks from Connecticut are right here in the front row.
Hello, Connecticut.
Okay. Critics of this bill say mentally ill people will lose their rights to be in control of their own health care and may be forced to take medications or to be hospitalized. What can we take home to our communities to assure them this type of legislation will be a good thing for all folks suffering from mental illness?
So this is, on one aspect, this is a critical difference between our two bills. So the House bill has in it incentives for states to adopt what are commonly called assisted outpatient treatment laws. These are laws that would allow a court to order an individual to receive outpatient care. This is a highly controversial topic. It certainly is going to be a point of negotiation between the House and the Senate if we ever get there. Our bill does not have that provision in it. So that is a difference between the House and the Senate bill. It's important to note that even in Tim Murphy's bill, it's not mandatory. There's nothing in that bill that requires...
I think there's been some misinformation.
States, yeah, exactly. There's nothing in that bill that requires states to adopt that law. I know because Connecticut is one of 5 states that doesn't have a law that allows judges to order people into outpatient treatment. Now, there's good ways to do that, and there are not so good ways to do it, but there's nothing in the House bill that requires that to happen, and I think that there's going to be a really good discussion between us and between the House about how to reconcile those two issues. And then to the extent that that might be relative to HIPAA as well, there's this discussion about integrating parents into the care of their adult children. And listen, I think we fundamentally believe that the interpretation of HIPAA does not work today. It keeps too many parents outside of the treatment of their loved one, and that we need to reform that law to get parents back involved in the treatment of their children. And that will not force treatment on anyone. That will improve the treatment of millions of majority-age kids out there.
So first, again, let me compliment Chris, because Chris was very clear when we started that he didn't think we should be as strong mandating AOT. So just had a mental health forum back in Louisiana with the St. Tammany Parish of suburban New Orleans, and doing a lot of good work in terms of this. And one of the judges was there, and he said, listen, if it's AOT, we have an AOT law, but unless I can throw someone in jail, there is no bite if they don't show up for their visit. Now so kind of gave me a different understanding. Wait, you've been picked up and you're not going to get thrown in jail, but nonetheless you should be in treatment. So in our bill, we seek to encourage best practices, and then hoping that best practices are communicated one to the other. And at the same meeting, the police chief of Covington, I think it was Covington, said, oh yeah, we just put in, I think it's the Angel program, where an addict, which we picked up from elsewhere, but an addict can walk in and say, I'm an addict, I need help. Here are my drugs, here's my paraphernalia, no questions are asked, no charges booked, they just take them immediately to rehab. And in the first month, they've had like 50 people or something like that. Now that's a best practices. Now the degree to which we can take best practices and cross-pollinate is great. And so again, I think Chris is the wisdom he brought to this is continue to bear benefit. And secondly, as regards HIPAA, isn't it interesting? Again, if that adult has diabetes, We don't have any compunction about saying, Mama, he's an adult, but nonetheless, he needs to take his insulin in this fashion. He needs to come back. He needs to check his blood sugar. But mental health, we don't. Okay? Then we say, there shouldn't be a stigma in mental health. No. Oh, well, we shouldn't treat the two differently because one is just an illness, the other is an illness, so therefore it's a different organ granted, but just like the liver is different from the pancreas, different from the colon, so the brain is different, but nonetheless. So on the one hand, we all agree there shouldn't be a stigma, and on the other hand, with our privacy laws, we stigmatize. Now, I'm a doc. It's an illness. It's just something you got to cure. And if that parent or that caregiver is not involved, you're less likely to cure. Someone says, we are so careful about rights, we're going to let people die with their rights on. We need to get rid of the stigma and treat, as he says, treat mental illness as we do physical illness.
Okay. One last question. This came up in our Public Policy Council yesterday. Next Congress, could we talk with you guys about potentially, again, this might be for the next president, what about setting up a Peace Corps type action program where we trained paraprofessionals, whether they were newly graduated from college and they got some training, to go into the community and help identify and get people to the right places, whether it be working with the local sheriff to make sure that someone's not taken to prison, but maybe going to a diversion house, much like the sheriff talked about at your mental health summit. You know, what are the things that we can do in the short term? Because clearly there are not enough mental health professionals. Rick Kirchhoff's from the state of Illinois. In half of the counties in that state, there are no psychiatrists in certain counties. So what do we do to deal with the health force issue? You know, provide incentives for students to go into underserved areas. And again, we're so proud of both of you. You know, we're in for the long haul, and we'll do what we can this year on your legislation, and we'll be here next year with you to work on the next iteration and the next generation. So just maybe some crystal ball stuff of what we can...
Well, the legislation does provide for more providers.
Right. Yes.
That's number one. Number two, I know that telemedicine, telepsychiatry, if you will, is being employed more and more. Three, what you're describing is, I think, a continuation, for example, going back to St. Tammany Parish, but this started elsewhere, the CID, crisis intervention training, that law enforcement gets. So that they've learned that normally law enforcement wants to take charge of a situation. If someone's mentally ill, that's not possible. And it merely escalates. They learn that, they back down, and they bring in the resources. All that is being driven. Going back, what I said about Garrett Lee, when this passes, you should get the award. Because CIT was concerned public officials, probably with a personal experience, but also hearing from others with personal experiences, to begin teaching officers that which would better equip that officer to better handle a situation which had to be handled differently. Now, that's y'all. Now, whether it's encouraging your local law enforcement agency to have CIT, or perhaps working for a court to expedite management of such patients, or the partnership that breaks down silos between healthcare, legal, and law enforcement, so that when someone is picked up, they're quickly disposed. Bexar County in Texas has done such a wonderful job for this. That is going to be driven by y'all.
Yeah. So I think it's critical, and I think that Bill's on to a really important point. Yes, we have to get more full-time mental health practitioners into the system. Really, the only way you do that is by increasing reimbursement in the long run. Yes, you can build a new Peace Corps, but the reality is that unless you pay people what they're worth, people aren't going to do this for a living. But let's think creatively, like Bill said, about how we can make more people mental health professionals. So in our bill is a big build-out of something called mental health first aid, which is just a little bit of mental health education for teachers, for anybody on the front lines of seeing kids and adults who can recognize those initial warning signs and can refer as quickly as possible into professional full-time treatment. So that's another way that you can build out workforce. So yes, I think that that's critical, and I think the answer is, of course. I mean, we're going to come back and keep working at this. For any of you that have ever been to a congressional hearing, you know that most of the hearings where the members sit are horseshoe tables, and so the chairs of the committee sit at sort of the top, and then as you sort of go around, you get less senior and less senior and less senior and less senior. So Bill and I are both on the health committee, and we look at each other from the bottom of the horseshoe. Bill and I are the least senior members of that committee, and that is good in that we hope that we're going to be around a while, that we're going to get to partner on this for a long, long time. As you can hear, there is nobody more passionate, more persuasive on this issue than Bill, and I think that this is just the beginning of what we hope is a career-long partnership.
And let's give it credit because Ranking Member Patty Murray and Chair Lamar Alexander are into this. They want to see the legislation passed, and they're working hard. If you have a chance to meet with them or their staff, thank them very much.
Guess who we're giving awards to tomorrow night?
Oh, great.
Patty.
They've been fantastic on this.
And Harry Reid's getting an award.
Good.
So let's stand up and show these two American heroes how much we appreciate.
My Louisiana people.
Thank you.
Thank you, John.
We'll let you know. Okay?
Thank you, man.
Thank you.
Appreciate it.